So we've been pretty aggressive here in Massachusetts. We passed 4 different pieces of legislation, some embedded in state budgets and others as separate pieces of legislation. So we're increasing the amount of treatment available, the number of treatment beds. We're also reducing the number of pills that you can get in your first prescription so that people will have fewer pills sitting around in their house. And we're giving also the patients the option when they go to the pharmacist to say to the pharmacist, the doctor prescribed 30, but I really don't think I'm going to need 30, just give me 15. And we're making that kind of thing possible for people. We're also, we also changed the law and made fentanyl a crime to include fentanyl in heroin. When you mix it in, it makes it much more dangerous, and that's where a lot of the overdoses and deaths are coming from, is mixing both the heroin and the fentanyl. And up to this point, there was no additional penalty for mixing the fentanyl. We made very stiff penalties for doing that. So there's a whole range of things that we're doing to try to help people once they're in the system, to try to get the treatment and the care that they need, including aftercare, because once you get addicted, your brain chemistry changes and the cravings really control you, and that's the danger for people once they become addicted. And so we're trying to support them once they get out of treatment by making sure that the tools are in place in the community for aftercare. And it really takes a community of caring to be able to help these folks beat it and stay sober and stay clean so that they can have a chance of really getting back on their feet.
So the deaths do keep rising. Why has this been such a tough issue to crack from a policy level?
Yeah, the problem is that there are so many people who are already addicted at different levels of addiction that it's, no matter how many rules you put in place now and how many programs and services, you still have this huge backlog of people who are already addicted.